Good morning, good afternoon, or good evening, depending on from where you are joining us today. And welcome to today's online seminar, the role of the importer under the MDR and IVDR, some myths, misconceptions, real obligations. So this webinar is really dedicated. So this is a series of several webinars about the same similar topic, the importer, that we presented from MDSS parts, and this time we are really going to try to get on clarify the real obligations for manufacturers and importer, and alongside with some myths and misconceptions that we are still seeing nowadays that is happening in the medical device world. So my name is Carla. I'm the Sales and Marketing Director at MDSS, and I will be today's moderator for the webinar. As you notice, the webinar is being recorded. The recording and the presentation slides will be provided at the end of this webinar. Small note, please use the Q&A or chat function. I will keep an eye on both of them. So we want to have this webinar very interactive. So please feel free to ask your questions alongside with the presentations for specific topics. I will make sure that our speaker today address the questions immediately. If you don't want to have your name, you can also post the questions anonymously. There is that option, so feel free. If you want to be more personal, if you want to pose your question live, just raise your hand. I will unmute you, turn on your camera, and you can also pose the question personally during the webinar. So up to you. So a little bit about MDSS for those who still don't know us. So more than 30 years in business. Main focus is in-country representation and regulatory consulting that is provided, and we are ISO certified. So I mentioned in-country representation in several areas: EU, US, UK, Switzerland, Australia, and just Newfoundland, New Zealand. And with that, we also provide some other supporting other additional services and additional regulations that we are seeing now, some horizontal regulations like the AI Act that is being very much discussed nowadays. Regulatory consulting for the EU and US market, so everything related with MDR, IVDR, and FDA. I will not go into the whole list. You can check that afterwards. Important, MDSS. We are a founding member of the European Association of Authorized Representatives, the EAAR, also founding member of the UK Association of Responsible Persons, member of the Swiss MedTech, also member of the MTWA, so that's the Australian Association, and we are a founding member of the RAPS Germany chapter, and we are an active sponsor of several chapters, local chapters, and also the RAPS conferences, the annual conferences, let's say it like that. And now for the most important part, let's go to today's speaker. As you all know, Ludger Muller, he will be the presenter today. I will not go to the list. You can see here a little bit about his experience, but mainly is the owner of MDSS GmbH, so the headquarters of MDSS located in Germany. And very important also is the current chairing the Association of Authorized Representatives, and on behalf of this association is a stakeholder on the group of European Union's Medical Devices Coordination Group, the MDCG guidances that we see published very often by the European Commission. And so with this, we have a voice together with the stakeholders from the European Commission. So Ludger, he has a career of more than over 25 years already in the medical device regulatory industry, and he plays a very important role in shaping compliance and strategies and influencing the several frameworks around the global markets. And with that, I will give word to Ludger, and then we can start the presentation.
Yeah, thank you very much, Carla. And just one correction, I hate it, but this year I'm turning over 30 years in regulatory.
I
So
wanted to make you a little bit younger. We'll not go to the 30s, you know. That's a milestone.
1996 with the implementation of the MDD. So yeah, thank you very much, Carla. A great job. So and why do we do this as authorized representative? And I just want to have a word on that. Importer, is that something we should be involved? Actually, not really. But the reason is we see so many questions coming our way concerning importer, what needs to be done there, and our clients get the question asked by the notified body, and I still believe they are utterly wrong. And so what we are trying to do here is to help you guys applying their regulation correctly. So we believe not to avoid the requirements, but we try to help to apply the requirements correctly, efficiently, and proportionally. And the importer requirement is definitely something, one of them, and also with the least burdensome approach. So let's stick to that and let's see what the solution is for a manufacturer. And as with the last meeting, we actually had importers online, and they ask as well very much questions. And don't let me spoil it, but as manufacturer, you do not have a lot of responsibilities towards an importer. And let's dive into it. What is being communicated? What has been done over the years? So now I need to share my screen here, the presentation. So I hope everyone can see that. So I already deleted from what Carla showed a role. The importer is not necessarily a role. It is something you basically become and by the mere act of doing. And but still the same topics, misconceptions and real obligations. Please note the disclaimer, always refer back to the regulation, and that's what I only like to emphasize. Everything what we are trying to do is based on the regulation, and please go back if you find an interesting interpretation which I'm bringing up in an opinion. Please go back to find the right solution in the regulation for your device or your company, making sure the regulations are complied with. So let's start with the dialogue. I'm so surprised with the dialogue between notified body and manufacturers. There's not much dialogue in some areas. It needs to be requested. But what I encountered was as well that questions are being raised and the refusal to explain why the questions are being raised. My recommendation is really to know the regulation, the MDR, because questions are being raised which are sometimes not really related to the MDR. For example, the question which I'm going to bring up in a little bit. And it is very important because questions are being raised, and based on the question, somebody thinks there must be a requirement. And there's none. And that's very interesting how such dialogue may lead you going into the absolutely wrong direction. And this conversation can certainly be costly if not being verified by the actual regulation. And let's look at the economic operator, importer requirements, a blessing. Is it actually a blessing? So why I'm saying that? What makes an importer? Misconceptions and examples of device distributions. And this, in order to adhere to the time, I have basically added more information. So there's a whole presentation after this presentation, which was previously presented. So this is as new information, and you get the old presentation along with it. I updated this a little bit and tried a little bit of a different approach here. So why a blessing? So here you see the manufacturer outside Europe, here the big pond, maybe USA, the Atlantic, and then it comes over to Europe. It is being received by an by an importer. He is buying the product from you. So what is an importer? In the first instance, and in most cases, according to our clients, there are customers. They pay the manufacturer. There may be different solutions out there in terms of who the importer may be, but normally it is like I experienced with one of my clients visiting them in Southern California and asked them what are you doing with the importer requirement? What do you mean? Yeah, are you being asked and being told to do something? No. We are class one. We don't have a notified body. So how does it happen? Yeah, we sell our product and our customers worldwide, they pick it up from our dock. Oh, interesting. Yeah, so they're not even sending it. The customer puts in the order and sends his FedEx or whatever transport they hire, and then they get it from USA. So that's also a possibility. It's not even being sent. So why is it a blessing here? Is because if the requirements would not be there, then the importer would have to check very closely the products he is buying, because he is the one who's making the product available for the very first time. And if he is selling it to somebody else, a distributor or patient, hospital, etc., he will be the one who is going to be liable, because he should identify obvious things. And if you look at the regulation, there are obvious things to check and not more. And that's what the requirements are for an importer. And if those requirements are not there, then the check could be going much deeper, opening up the product. And here's one aspect I experienced when I started my regulatory career with TÜV during training. An importer had TÜV engineer select a product, and then TÜV was testing it, whether they were okay, and then the CE marking was applied. So the testing was actually done by TÜV on a sampling basis, and that was rightly so. And who was responsible? The importer actually, who did that, and he put then later on his name on the product. And he became the manufacturer. So the role of a manufacturer can easily be done by slapping your name on the product. With the importer, there may be a couple of other aspects. But again, it's a blessing because it's written down. Common sense, checking declaration of conformity that the product is CE marked as well, the authorized representative is there, and certainly obvious things should be identified if the product is not okay. And that's what is being asked, nothing more. And why is it that the interaction between the manufacturer and importer may be in a way that you as a manufacturer outside the EU may not even know that the product is coming to the EU and is being bought by somebody? And that shows as well that the regulation works as well in that case, because the requirements are bestowed upon the importer and not being bestowed on the importer to be taken care of the manufacturer. So in this particular case, it becomes crystal clear the manufacturer sold the product to a distributor, maybe in the US, a US manufacturer in the US, and then the distributor may have bought too much. The product is CE marked, everything is fine, declaration of conformity for whatever reason delivered with it. And then he puts it on Amazon, and somebody in Europe buys this container of products, maybe not via Amazon, but of some other means, and he gets this product, and then whatever is in the regulation needs to be done, and then he can sell it. So, and that makes the importer, he buys product outside the EU and imports them into the EU. So what makes an importer? Invoice from a supplier. If the supplier is outside the EU, and then he gets an invoice from the supplier, then it's a good indication. It does not determine that, but it's a good indication. Customs record. He is in the customs record, because what happened if once we received a product from outside the EU, some client was so kind wanted to honor the great service one of my employees was doing, and he was sending a gift. FedEx called us up and said, you want to have this product, you want to import this from manufacturer so-and-so, and we are like a little bit surprised. And yeah, okay, yeah, what do we need to do? Yeah, we need your customs number, we need your information, and then we will deliver it. And sure enough, it was MDSs who did import the product, not FedEx, because they put our name down and they paid import taxes, and we paid FedEx these import taxes back, and then we got the gift into Germany, and I handed it over to. It was a very nice gift. I handed it over to the employee, and I thanked her as well for the well-established service she provided. So, and then there's another thing which is being utilized differently than what it was meant for. In the MDCG document 2021, there are in 2021-27 there are questions and answers concerning importer and distributors, and what determines whether a natural legal person acts as a distributor or an importer. So it becomes clear the differentiation between these two economic operators is underpinned by the definition of placing on the market. So again, I was saying the importer here, he is placing the product on the market. He is making this product, which is in this box, making it available for the very first time. And he will make this one, which is next in line as well, available for the very first time. That is just different, is a difference to the distributor. And then it goes on, if a natural legal person established in a union obtains, via transfer of ownership, possession, or on any other property right, which does not necessarily require physical handover of the product, a device from an economic operator established in a third country, and places an individual device on the union market, i.e., the first making available, that's what I said, that entity is acting as an importer of the individual device. An individual device, it applies to every single product, every single device. So it's not the placing on the market, the making available for the first time is product 1, product 2, product 3, product 4, etc. And then what is also being discussed is the physical handover of product here. That does not need to happen. And that makes us very clear. There was quite a bit of confusion, and some regulatory hardliner were saying you must receive this product in your warehouse in order to perform the checks. Drop shipping is certainly possible, not a problem at all. You send the product directly to the warehouse of your customers or to the hospitals. An MRI equipment is not going to be stored and built up at the importer. It will be sent directly to the hospital and being installed, and then the one who is paying the agent, the one who has bought it and has done the sales, will invoice the hospital, and the MRI manufacturer will invoice that importer. So that makes up then the importer. Interestingly, all these kinds of things were heavily discussed during Brexit. When Brexit had occurred, how can a product still be placed on the market? When is it considered to be placed on the market to avoid some Brexit as situations, because it was coming very, very sudden and very interesting. All those documents have been deleted, and I'm actually very upset that I did not download it. It was very interesting to read when the changeover, the product was actually bought, and when it could still enter the EU market, even though it was not there yet, and Brexit occurred, etc., etc. So very interesting aspect. So what makes an importer? We already said some of the aspects, but also what else is there for an importer? So MDR Article 13 is one thing. Waste regulation, better regulation, roles, and I think we are about to come up with a webinar for the packaging regulation, which has been updated. That's all applied for the importer of the product. He is receiving it first, he's placing on the market, and that is impossible really to take care of the manufacturer, because those regulations are then as well handled locally in the country. Under very rare circumstances, and we will outline that in our seminar, manufacturers may then take care of it, and the rare situation would be if there's direct sales. So I already mentioned that direct sales is still possible to the end user, And then the question is what happens to all the other regulation. So these relations show that the importer requirements are bestowed upon the importer. It is a person or legal entity, and there's no mentioning that the manufacturer shall verify or check whether the importer fulfills his requirements. No control and no audit by the notified body, because the question which is being raised, and actually going a little bit further, what control must be applied by the manufacturer on importer and or distributor? Very interestingly, what happened was that notified bodies were under the impression, whether imposed by the competent authority, I don't know, but they are supposed to check the manufacturer, that they have control about the importer and the distributor. Interestingly, that with the distributor stopped rather fast, because the clear indication was the manufacturer said, we don't even get any information. We only know who we sell the product to. And then the notified body said, yeah, okay, you don't need to have control about the distributor. Now, actually, the same applies as well to the importer. You don't need to have any control about the importer. So very interesting that that aspect was resolved, but it was not going one further step. And I think that has a little bit to do with the communication, with the dialogue, or with the non-dialogue. Questions are being raised, and apparently information is being, or requirements are being created just with raising those kinds of questions. And those are not requirements. There's nothing written between the lines, etc. So here are the misconceptions which still come up, and that just blows me away. But the first ones seem to be quite resolved. The manufacturer must appoint the importer, so notified bodies seem to have learned that. Only the authorized representative needs to be appointed, designated, the second line. There must be a contract between the importer and the manufacturer. No, the MDR does not require that. It may be wise to have a contract, but the MDR does not require that. It requires to have a written agreement between the manufacturer and the authorized representative, or in the current MDR, because that's going to be updated as well, that for high-risk class products, you can utilize or in order to not to do clinical studies, you can utilize, if you can, the technical documentation of somebody, and that needs to be done via a contract. So the MDR really clarifies where a contract is needed. Only one importer is allowed by the regulation. Oh my God, what a story. My client called me up. My contact was very convinced that I would support him. And I said, the question was, the point was that he was faced by the notified body that they only could have one importer, and he needed to tell his VP of sales. So VP sales was online, and I was very careful communicating that, because as well, the correction needed to be done that you can have as many customers as you want in every country. And how much the relief was then that there is no such thing to organize it with a single customer, to have the sales organized that way, because everyone gets different different pricing, right? You sell your product, however you can do it, that's up to you, and different countries may have a different sales point, and therefore you want to deal with different customers in that sense. An importer must have a QM system or needs to be qualified? Absolutely not. The importer is a supplier. One word to that, qualification. Yes, in Germany, in Spain, and I believe in other countries as well, whoever deals with medical devices has to have some qualification. Those are national laws. That is not regulated by the MDR. And in Germany, there's supposed to be a medical consultant. If you give products to somebody else, to the customer, then you have to have a medical consultant on staff. And in Germany, for example, the counterpart is well installed in the hospital, so the right people talk to each other. And therefore, there's no concern. QMS does not need to be, it's not a requirement. The importer is a supplier to the manufacturer, and the manufacturer must control the importer accordingly. I already stated that. That requirement blew me away when that came up. And that was, I think, 2020, 21, when And the deadline was coming. I was doing seminars in the US, and one listener participant raised his hand. Yeah, I got the recommendation from my notified body. I should put my importer, right, the importer, on the supplier list. And then with that, I can control them. And I'm like, and I asked them, you want to actually put your customer? You want to evaluate your customer? And what is the marketing and sales team to saying to that? That's like, yeah, you want to evaluate your customers as well to some extent. Are they paying on time? Are they treating the product correctly? Are they doing the right marketing? That may be checked, right? Because you don't want to have any claims out there. That happens as well, but normally that's not a problem at all. And that's, as I said, they are being controlled by the authority here, and normally they act in accordance with their requirements. The importer is not allowed to distribute the device. That blew me away. That comes from the definition. The distributor is not an importer because it cannot be, because he's never ever be able to do what already has been done to the product. Because if the distributor receives it from an importer, he is the one who receives it from somebody who is making it available for the first time. Once that has been done, it cannot be done a second time. That is the clarification with the definition of distributor. That doesn't mean that the importer cannot sell the product to the distributor, patient, hospital, etc. He can sell it to anybody. So nothing of this applies. So these are the misconceptions. So during an audit, actually, that what I actually experienced. Do you have a contract with him? So yeah, and also how do you control your importer? And it's still around and very interesting. And no, we do not control our customer's importer. If we would control the importer, then they could be influenced to do the checks required the way we want it. I think that would be an appropriate answer to do, to say we are the supplier and we'll leave it up to them to scrutinize the device. They may find issues we would not identify if we would control their action. And I would even go one step further. The notified body should actually check the independence of those kinds of checks. So very interesting question. Contract, we clarified that, no need, but when I was part of the audit, we clarified that and it was accepted, and therefore no further questions are being asked. One other thing which just blew me away during the assessment is that the notified body is being looking after Annex 9, and he has very specific points to look after. That's what the application, the manufacturer does an application, I think Annex 9, to have the notified body look after Annex 9 2.2 and not more. And everything else, what is not okay. So recently, the regex gave some indication of that. There was some comment was that notified bodies start to remove the reference to Annex 9, Chapter 3, which are the administrative provisions. And I'm like, why is that? That's very interesting. Why do they do that? I was under the impression that that is indeed needs to be there. And I checked Article 52, the requirements for manufacturers, obligation for manufacturers, conformity assessment. Yes, there's Annex 9 and different annexes for different risk classes, but Annex 9 and Annex 3 for risk class one with a particular, in this case, with a reusable function or sterile, I don't remember. And then the question was asked what the notified body should look at. And then I'm like, that should then be on the certificate. And then I looked at Annex 9. No, it shouldn't be on the certificate. Annex 9 2.3 refers to the notified body should receive an application to check the elements of 2.2, if I'm not mistaken. Please check it for yourself. But it's very interesting. Finally, the notified bodies see what is actually required and don't overstep. And guess what? An administrative provision is not of high risk. A manufacturer can do that on his own. Right? So that does not need to be checked by a notified body with a lot of resources to check all of that. And also, it comes during the audit because it has some, the administrative provision also has some requirements for storing, etc. keeping products of QM system available. That's part of ISO, but it does not need to be confirmed on the certificate, and that would be an overreach by the notified body. So it's being removed, and it's good to see that they are doing the right thing now. And then the importer should not be on the audit plan at all. This is one of the earliest slide and developed in 2017 when I was thinking about the requirements. And what is the requirement of the importer basically doing? It's checking the device and the manufacturer. The distributor is doing the same, right? This is unfortunately bigger. It shouldn't be bigger. The distributor is checking importer is checking manufacturer, and distributor is also checking manufacturer. And it becomes bigger because it has a wider range here. And the authorized representative, you also are required to perform certain checks so that only safe products are being received by the patients. And then there are requirements for the importer, certainly to look after storage requirements, to look after transport requirements, but that's on the label, and the importer can see that, and he has to adhere to that. He bought the product in his possession. And again, they are being inspected here in the EU now by the competent authorities. So the regulation is very crystal clear. And what is left for the manufacturer and what may be looked at after for the notified body, because that's the obligation of the manufacturer, quality system, what should be part of the quality system, clearly stated, Article 10.9J, and in communication with competent authorities, notified bodies, other economic operators, customers, and or other stakeholders. So handling the communication, how do you handle the communication with the importer of your product? What happens if he sends you a complaint? What happens if he sends you a serious incident? What happens if he tells you that he has informed the competent authority of a vigilance case, etc.? So he is supposed to inform the competent authority of serious of risk, not of serious incident, of serious risk, I believe. So, and that's not in vigilance case yet, because the importer is not being required to know that. He's not being trained. He doesn't need to know that. He is giving you a complaint. It's a manufacturer's obligation to check whether it is actually a serious incident. And then Article 25 is as well their identification within the supply chain. So as manufacturer needs to know where he sold it to, and the importer needs to know where he got it from and where he sold it to, and the distributor the same. They need to know, and that's common sense, and it's being required. I believe that it's actually very interesting that is a requirement. It's common sense, but guess what? In the early days of CE marking, a distributor did not wanted to be part of the recall because he didn't know where the products did go. So he had to really dig very deep into his records. And then the other thing in terms of the relationship between the manufacturer and the importer, just right from experience, was recall. Again, we were supporting the client with a recall, and they called us up and said, we got some very severe feedback from one of our previous customers. He does not want to participate in recalling the product, but we know we have delivered products to him 2 years ago. We don't have a relationship with him anymore, and now they refuse to support this recall. And very interestingly, we were as well had a question mark in our head, and we basically said, let's call the authority. With the permission of our client, we called the authority, and the authority was laughing his head off, and it's like, don't worry. And just a couple minutes later, the importer called us and said, what do we have to do? And so not a problem at all. The requirements are bestowed upon the importer and not upon the manufacturer. What's left for the manufacturer, and that's just a recommendation. That is not part of the regulation, but if you read the foreword of the preface of the MDR, there's one piece that the importer is liable together with the authorized representative and the manufacturer, etc. So everyone is liable. Only one is liable, or only put it this way, only the patient is only eligible to one-time compensation, not 3 times compensation. not from the authorized representative, and receives the same amount from the manufacturer and as well from somebody else, the importer. Now, liability is regulated as this is being taken out in the update because this is clearly regulated in the liability regulation. And liable is a manufacturer. If there's no manufacturer, then the importer is liable. Third one is the authorized representative, and Amazon is as well in the boat. Here is the third-party logistic provider is as well listed as the entity being liable. So, and you might want to protect as well. And if you want to do something good for your business, because normally that doesn't cost much, put your customer on the vendor's endorsement of your liability insurance as an additional insured, and they very much like it. That will most likely reduce their obligation of insurance significantly if it's being clear that the product is covered already by some insurance. I would not recommend for an importer to get rid of his insurance completely because the liability is first placed on the importer and then upon us. And if the importer can be identified, which always can be, because the importer needs to be named with the product. And here, this is also very interesting, that I hear that some importers may not want to do that. That would be an interesting indication, because my nephew took over the business from my brother, who took over the business from my father, so third generation. He is getting in there in the business, and he identified the supplier of the supplier and is importing the product now into the EU. Guess what? He puts his name on the front, on the back, everywhere, to let the neighbor know, the one who bought it, to let that neighbor know that the product comes from him. So that's something to...
Yeah, that's marketing.
Exactly. Thank you, Carla. And as well, there may be a shift in terms of this, that the importer wants to be named, wants to take care of it, because the requirement is that they need to be found, and they can only be found if they are actually in EUDAMED. And EUDAMED is going to be the source of all. It's going to be the source of all information. And if the importer is not being listed, how can he do business? So that's one aspect here. And that gives him a prominent position in the business. And that makes life as well easier for the importer to become known. All right, so if the requirements may be looked at this way, and answering the questions and exploring the question of notified bodies maybe a little bit differently, start the dialogue with knowing exactly the regulation, then there may be a lot of money to be saved, because I see currently quite a bit of artificial things are still being implemented, which does not support much, not much, because it does not support what actually is needed. So if everything is done correctly and you actually don't need to scratch your head about the requirements, you know them, then you're going to finish first here. With that, I thank you very much. And are there any questions?
Not yet. So let's see if some question comes up. But I think you still also have a couple of more slides to practical examples that I think it's very interesting for people to see.
Yes. So if there are any questions, please just interrupt us or put them down in the Q&A. There is a red dot on my side. Is there a question, or is it just an information?
Just information.
Yeah. Okay. Good. Now I got rid of my red dot as well. All right. Yeah. So what I can present a little bit, we just still have a little bit of time. So what is in with the next slides, which are coming, the definition, the actual definition. Manufacturer markets the product. He's not placing it on the market when he is outside the EU. That was made clear. When I was auditing, we were telling the client during the deadline 1998, oh, sell it to the distributor in the US. You have placed the product on the market. That is gone with the new definition. And then we do have the next definition, importer, and placing on the market. That goes along as well. And then here is a little bit the legal responsibility because of the placing on the market. And here are the importer requirements repeated. And if you go through them, they make common sense, which is being mentioned very often, shall indicate on the device or on its packaging or in a document accompanying the device their name, address, etc. So it does not need to be on the label, and it does not need to be done at the manufacturing side. That was as well, it blew me away when the first question came. Our notified body auditor asked us, when are we going to put the name of the importer on the product, because that's a requirement. And yes, it's a requirement. It must be done by the importer. And it's, the MDCG document clarifies that the product can be safely sent to the customer, and the customer has to add his product, his information. So if your customer asks to add his information, then it would be according to ISO a customer requirement and not a legal requirement. So very careful on that. And then what makes...
Sorry, let me interrupt you, because there was a question on the slide that you were presenting, and I think it's a very interesting question now in terms of the labeling of the importer name and address. So for the EU, is listing the importer in Yodamed sufficient, or should this be on the packaging or a document accompanying document, the product like invoice and so on? Yeah, that's a very good question. Now with the Yodamed implementation, will the regulation be updated to remove this, or you believe not, that it's still going to be listed in Yodamed and in a document that goes along with the device until the final user?
I think the indication of the importer will not go away, because you find it in other regulations. You see that everywhere. Yeah. So you see the importer being identified on the product. But you don't need to, if you sell directly to someone, then there is no importer. I mean, somebody who's using it. Then there's nobody in Yodamed, then there is no importer. Right, that needs to be. So Yodamed needs the information in Yodamed, must be in there. I think we're still in the transition period. Nobody will go after any importer, but after the deadline in November, I think all the importers should have their information there, and then the thing comes slowly in place that importer must as well have their name with the product. So there's still the transition period, MDD product, because that can go even beyond that. Whether that would then as well, if it's an MDD product, whether the importer would have to, yeah. I mean, I think it's a no. It's going to be we need to look at it from a different perspective. I think whether there's a real legal requirement to do that, I think we need to look at from the perspective, hey, I want to sell my product, and it would be good I found on the internet, and if it's in Yodamed, great. So I want to put myself with the product into Yodamed, and that would help sales probably pretty much in the EU. The more you're being out there, because the AI will find the importer if that's the one who is going to do the sales for you. So I mean, that's taking a little bit of a different perspective. So I would have to look at the regulation whether there's any changes, but I don't remember that requirement will go away. I don't think so. But I would have to verify that. Very good question. So, but again, it does not need to go on the label. Absolutely not. The importer can simply say, here's my package slip. He knows what has been stated. It should reach the final user. So I understand that, because what it's really for, keep in mind, liability. That's the real aspect of it. What's the real aspect of the traceability of UDI? Logistics, right? All these aspects. There is certainly traceability, great, but it will probably make the logistics in Europe much faster. So there are different aspects on it. And I was. It's not my observation. That what I was told why things are being done the way they are being done. And sometimes they have a little bit of a different perspective. And in order to get your stuff done, I guess the UDI to put on the product may give you a market advantage if you don't have it yet. Now it's a requirement anyway, but guess what? Yes, it would be probably useful to have that. Okay, so any other question? No, not yet.
Yes,
so
yes, we have a question on the chat. So this is our favorite question, your favorite question. there are companies that offer manufacturers the service of acting as their importer. These companies are not part of the supply chain. How does this concept work, and what is the legal basis for it?
Good question. So I don't think it's forbidden, but I have make the case if I buy the product, I on the records in customs, and I sell it to somebody, I fit very much the definition of this importer. I would have, those are great indication that I am the one who is importing the product and the requirements apply to me. So I'm aware of this service. We have entertained that as well, and we will as well, what can I say, support clients when they would like to do that. We are not, so we have seen different approaches by different competent authorities. Switzerland was very interesting. They may come down to that differently. Currently, they seem to accept that. Ireland cut it down. They saw the product came in from England. The invoice was from England, and they did not let them got away with, oh, there's a French entity identified as the importer, and they asked them, did you buy it from them or stuff like that. And on the other hand, this entity, this distributor, who then assumed the role as who took on, accepted that he as the importer had not a problem with it. He was actually asking himself, why not, right? So that's one other aspect on it. So there may be aspects where that may make sense, but I would not artificially and do that, because that costs money. What is being done without any money? It's not a requirement to control the importer. And one other thing, and I'm questioning that somewhat, because it's then a contract between a manufacturer and some entity who agree on the inspection. Now, where's the independence, right? I'm selling the product to you. You have your requirement. You check what you need to do. So there are interesting aspects, but it goes along with for the importer. If you put your name on the product as the manufacturer, you are the manufacturer. And I would believe if you in front of a court and I put your name with this little symbol next to that symbol as importer, you most likely will be identified for all aspects in front of the judge, because he may not go into the details whether somebody else did applied any regulation. So what I did here, I am just the importer for the MDR. I have nothing to do with any other regulations. That one may become difficult, right? And the inspection currently in Europe, which are taking place, are done by the medical team. But if that expanding to environmental and interestingly, the medical authorities are very not much, and there's really not there's nothing to penalize really, because if the product is being safely sent to the customer, further distributed, I see some deviations which are funny. And so forth, what is being inspected, and they want to have it now documented, which is like, I'm doing it, now I need to document. It's nowhere stated you need to document it. And whenever, there's not a single time in my career that an incident was caused by an importer. What I can say is distributors, if there is a high not a high risk, like an IVD product with temperature limits and stuff like that, that may be the case. So then they need to be looked at after and so forth. So that's maybe a critical thing. But that's the obligation of the importer or distributor, not of the manufacturer, because next in line is a distributor, and you will have no say, and never ever will say on any of that. So yeah, so it's a thing. I'm careful in that regards. We do have now engaged with a company who will support our clients for all the other regulation if there should be applicable to our clients, but as well and here I notice as well from the last time an importer got out of it and they put a note down, thank you very much, we're going to look at the other regulations now. And I'm like, okay, pretty good. Protect yourself. It's wise. So so if you want to pay something in addition to what does not need to be paid because the customer has to do it, and there's nowhere in the MDR that as a manufacturer you would have to do that. So if that's it costs money, right? So and the importer or distributor, the requirements are almost the same. And the only thing is really the liability, which could play a role. That one is easy to resolve. Okay, and yeah, you're welcome.
Yeah, we had a couple more questions from one person, but I think that's already said. It is mandatory to appoint an importer. We already said no, that's a misconception, or to have an agreement established with each of the importers. No, there is nothing on the regulation that says that. But one of the questions, and I know that you have a slide about that, is a little bit, can the importer be the same party as the distributor? So the importer can be also the distributor, but not for the same device. And I know that we have a slide on that. So if you maybe when you go there, you can dive in a little bit more into that.
Yeah, so I'm going to go quickly through the slides. We're getting it. We still have a couple more minutes. So still not an importer to the MDR. What's missing here? Purchase a device from outside EU, takes over ownership, deals with customer indicated by customs authority, etc. So that's on these slides here. You may have a look at this. And then key concept, I'm repeating this here. And then the aspect of whether the importer can distribute the product, and that's what he is doing, right? Here is the importer and he sells it to the distributor, not a problem. And here is the definition of the distributor. But now let's get into it as well. Here we do have product number 2, 3, and 4. Each one is a single individual. That's what the guidance tried to do. Number 2, it was sold to the hospital. Number 3 was sold to the patient, and number 4 was sold to another distributor. So that is not prevented due to the definition. I know that is being used in order to scare. I have to say that because I noticed that during a presentation of this, and it was done by a consultant or something like that. No name. I don't want to blame anybody, etc. So misunderstanding. The distributor saying, oh, the distributor cannot be the importer, right? No, the importer cannot be the distributor. It is absolutely, and now I'm using a word, I'm not going to say it, I have it in my mind. It starts with B and in the middle is an S, and you make up your own mind on that. So I do have a couple more things in terms of how that can be distributed. So we were saying we had here from manufacturer to somebody who imports the product. And then we as well, and there's no saying that somebody must sell to the importer, right? It can be sold directly to the hospital. And then I said the MRI system probably directly sold to the hospital. Then they put it into service. And here it can be sold to the patient as well. So they do not need to fulfill the requirements of an importer since they do not place the device on the market. The hospital is using it, the patient is using it. So the requirements really apply in 2 conditions. The condition is, and as well for the distributor, the condition is that you obtain it and then you sell it. So if I buy a product, and I have done that numerous times, buy it from the US, import it into Germany, and then I use it, then I'm an importer, definitely, but there's no requirement whatsoever. Guess what? I'm buying hundreds of these products now. I flew back and that's what my nephew did. He did fly to China and then getting the products into the EU. Now they are being shipped to me. Everything is fine. Now, if I sell those products and I do not appropriate, doesn't need to be just to be clear, nothing needs to be done by the importer, or everything can be done by the importer to make sure. If then he sells it to some user in the EU, in Germany, for example, I would sell it to this another person, and he is using and he is hurting as buys an electrical device from me, and his house burns down. He could come back if he can show that product was the cause of it. He could come back for my life and to get to hold me liable for it. No court will go outside the EU, outside of Germany. I would be the entity to ask for the compensation, and that's it's normal in every country since the existence of states. That's how it is, because the police has no reach to any other country. There are some contracts in place in the EU. Yes, they will call the French police and then they will get to the French importer. That can all happen, but not from here to the US. And so Europe is one legal entity in that regards, but not outside the EU. And here's device number 7. Sold to the distributor, as I already explained. He bought too much and then he is selling it to somebody in the EU. What is this entity here? Anybody has an idea? Because it's a little bit of a quiz here. What is this entity? It does have the right color. If somebody dares to write this down in the chat, maybe. It takes a little bit. No, that was a little bit by surprise. But everyone probably has an idea. That's an importer. And then we have device number 7, and now device number 7 is being sent to the previous importer. So what should happen now? He should change his color. He was for the device number, what was it, number 2, 3, and 4. He was the importer, and now he is a distributor. As simply due to the supply chain, and not a problem at all. So this comes from the vigilance thing, or economic operator. So I want to have a word on that just to explain that. Here are the obligation of an importer, and therefore you don't need to have any control. It all comes to you. The importer and the distributor have obligation to inform you of complaints of serious risk, etc. And they will also inform the notified body, the competent authority, the distributor, the competent authority in case of serious risk. You may want to have a contract if they do this here, that you are being informed, but there's no obligation for them to do so. How often did we get calls from the authority and our client didn't even know what was going on because the distributor informed the authority? That's their obligation in some countries. Was it already in place under the MDD? It is part of the MDR, and then that's not going away. And so you see one single event here. If that's a patient here, informs the distributor, that goes directly to the manufacturer, goes to the importer forwards as well to the manufacturer, may go, if it's serious risk, to the competent authority, to the notified body. The EC rep certainly is also being informed, and you may receive from several entities information from one single event. That is actually done too much, but you don't need to inquire about any information with the importer because that is enough. And here's one other word to the Brexit. Manufacturer sells this product to this entity, and if it's from the European entity here, EU is being here the channel, being sold to somebody in the UK, then that is an importer. He would be the importer from the manufacturer directly as well here. But again, not a problem at all. That's actually a blessing. And in the UK, we don't have any such requirements specifically there yet, but there's normal aspects apply. This entity would have to inform us as UK rep to inform the MHRA database of his existence. So there's another thing on the MDCG documents, and that's what I wanted to, maybe what I forgot to say, and that comes to my mind with one of the questions. If I am as an importer, I buy the product, I'm in customs, etc., I may have to take off any other one who is identified as the importer. So the importer should replace any previous importer details with their own. If having investigated the issue, they determine themselves to be correct importer, the label with the previous detail will be void. What can happen? So the label, so that's certainly not good here. The economic documents with the previous details will be void. What can happen if somebody buys the product, is importer, and then he sells it to the UK again because it has not been placed on the market with that, and then he sells it, the guy in the UK sells it back to the EU, re-import what is it called? Then the one who is really then placing it for the first time on the market, that would be the third one in the row. So manufacturer to importer in the EU. The importer has no legal obligation, but he may put his name on it. He wanted to sell it and now he can't, and he has a customer in the UK. He sends it over to the UK, and the UK guy found another entity in the EU to sell it to for whatever reason, different country, different pricing, and then the one who receives it then cannot rely that is the importer, because that other legal entity never placed the product on the market, and that needs to be looked at. So if there is somebody puts his name on the product, may not prevent that, but if he can prove that he was, for traceability, sent the product to the UK, he's going to be released from his responsibility. And the one who is not putting his name on the product and has sold it may face some legal concerns if that is being identified. May be difficult, but you never know. So as the arrows showed, there's a lot of going on. So I'm not against agreements, right? Contracts as well. If you want to get money and you want to have something in place, get that going. So a solid agreement with your customers certainly makes sense, but it's not a requirement of the MDR. Just to be mindful of that. And that's the second thank you. And I'm 1 minute above the time.
1 minute.
So I got completely through of all of that, but on some slides very, very briefly. So you will get the whole presentation with everything. If you have any question, please let me know.
Thank you, Ludger. As always, a very interesting presentation and questions also and discussion. So thank you very much for this. Yeah, so as you were able to see during this presentation, some challenges come not from the regulation itself, because I think it's crystal clear, but from some of interpretations that are done. So here at MDSS, we really, like Ludger mentioned at the beginning, we really want to have the least burdensome approach for our clients and to support the manufacturers applying the requirements that are bestowed upon them, but in a correct way and efficiently, and really that truly fits their organization. So if this presentation brought any other additional questions, feel free to continue to contact us for us to continue the discussion. The email address, our contact info is here. And we will be welcome to stay in touch and hopefully to see you on the next upcoming webinars that we are going to present. So keep an eye on that. And with that, we are finishing. So thank you very much again for joining us, and we hope to see you next time. Okay,
thank you very much. Goodbye.